So this is Mr. JR. He had a hip replacement on 7/28. Today's 8/13, 16 days post-op. We did the right side anterior approach. He was on the walker for a total of about 3 to 4 days, cane for 3 to 4 days. Jim, why don't you go ahead and stand up and walk for me? That's good. And come around, turn around and walk back for me. Are you taking any pain pills, Jim?
Not at all.
All right, good. Have a seat for me, and thank you very much.
Is that all right? I had researched all of the various options for hip replacement, and the anterior procedure seemed to be the most practical, the most realistic, and certainly the least invasive, as well as the offering the shortest recovery time. The surgery was on Wednesday. I was in the hospital Thursday and Friday. I was released on Saturday morning, and spent the weekend taking it easy, and started walking again Monday at home with the walker. In fact, I put in a quarter of a mile on Monday. And, the walker went away in less than a week, and the cane lasted less than a week as well. In fact, I was back at work the end of the second week, and I was driving the third week. It was absolutely no pain. I mean, I have to say that there was really no pain. There was pain in the hospital, which was very minimal. Sleeping's not a problem anymore. I can sleep on the operated side. I can sleep on the non-operated side. There's really virtually no pain involved with anything I do. No, I recommend it to anyone who has any problem with their hips. You know, anyone who's suffered the pain of walking or activities. I mean, mine was so bad. Look, I couldn't walk on it. I couldn't sit on it. I couldn't sleep on it. I couldn't stand on it. And there was one other thing I couldn't do with it, but I'm not going to mention that. Okay, it was just everything that I did hurt. And when you get to that point, yeah, I'd recommend it for anyone. The experience has been awesome. It has been absolutely awesome. The recovery is so fast, and the rehabilitation is virtually non-existent. The only thing that you really have to do, at least I found out, all I have to do is walk. That's the only thing. You don't need special exercises. You don't really need special equipment. You just get up and start walking. I can't be more enthusiastic about this. If people only knew about this procedure and knew that there was an option to the old-fashioned traditional ways of doing hip replacement, the docs would be so busy who do this that they wouldn't have free time on their schedule. Just to be able to walk again, you know, just to be able to stand up and walk for a mile, 2 miles. I walked 3 miles the day before yesterday. Just to be able to do that once again without having any pain is the most incredible gift that I've ever received.